This is Scott Becker with a special combined episode of the Becker's Healthcare Podcast and the Becker Private Equity Podcast. We're thrilled today to be joined by a brilliant leader and thinker and investor, Dhrooti Vyas. And Dhrooti is going to talk to us about what she's doing, how she looks at healthcare, and a lot more. Dhrooti, can you take a moment to introduce yourself and tell us a bit about what you do?
Thank you so much, Scott, and thank you for having me on. So, as Scott said, I'm Dhruti. I'm a healthcare entrepreneur, builder, and investor. I most recently founded a value-based care enablement startup called Crosswalk Health, which helps EMS agencies get compensated for the high impact, often invisible care they deliver in the community. I'm now working on something new, but today I'll tell you about Crosswalk. And then I'll tell you a bit about what I've learned about building venture scale businesses in healthcare more broadly.
Yeah, tell us a little bit about Crosswalk, but take a moment first and tell us where you're most focused today. What are you most focused on currently?
Yeah, so I am working on a new healthcare company creation platform. Healthcare incubations are a particularly fantastic way to commercialize innovation in this industry. And I can share some of the reasons why I am very bullish about this thesis and how we're thinking about it.
And tell us about that and tell us where that would fit in. Is that at the seed stage? Is that closer to more the venture stage? How does that look? And what are the different stages when people invest in healthcare companies? Because a lot of our audience is all over the board in this, whether they're familiar with seed stage versus not, versus venture stage versus PA stage. Where do you fit in, and what type of companies would you look at wanting to help seed and incubate?
Yeah, so I am thinking about venture scale healthcare companies, those that have the potential to generate financial return on a 7 to 10 year time frame and have the potential to exit for, call it, over $100 million outcome. And it's very interesting when we think about healthcare startups. If you look at the traditional pathway of starting startups, so for example, if you look at healthcare startups that go through Y Combinator, Y Combinator's overall realized MOIC on healthcare is somewhere between 1 and 2x, whereas in the consumer and fintech investments, that hovers closer to 7 to 8x. And if you look at the flip side, if you look at healthcare, health tech companies that have successfully exited for over $100 million since the passage of the ACA and returned investor capital, it's some 17.5% of those are incubations or corporate spin-offs. Think companies like Trellis RX or Landmark Health. Some are slightly more complex stories, two entities that merged and then brought in some corporate backing. Progeny's story looks something like this. But when I think about these data points, my takeaways are twofold. One is that there's a lot of complexity to the American healthcare system. So it's hard for an entrepreneur in the wild to start a health tech startup and be successful. There's a lot of alpha to being able to be slow and considered in the early days of launching something new. And then the other takeaway is that there are a lot of places in the healthcare ecosystem where things are working quite well, but they're subscale. So this is the story of Trellis. This is hopefully our story with Crosswalk Health, the last company I incubated. And that makes me feel very bullish about incubations as a mechanism for scaling these companies that already are demonstrating great unit economics and viability.
Talk to us about what does it mean to incubate? Obviously, we're familiar with the term from birthing wards, and we're familiar with it some in venture capital or early stage companies with Y Combinator and others. How do you define incubating? Just because a lot of people like myself aren't really sure exactly what that means. Does that mean you're the first founder, hire the CEO, find some seed capital? What does that mean?
Yeah, so incubating, I would say, means bringing together the ingredients necessary to create a great company. So that includes the concept behind the company, some initial capital, a great CEO and founding team to lead it and scale it, and a general kind of go-to-market playbook that the company can follow to grow. It's really hard for all of these elements to come together themselves. So creating kind of a contained environment that brings them together.
Thank you. Now, in addition to being a founder and incubator, you're also a double University of Chicago person, University of Chicago undergrad, University of Chicago Business School. And what is the best business school in the country?
Wow, that's a toughie. I gotta say my alma mater. I don't know what else to say, Scott. You
No,
didn't go to business school, did you?
no, I did not, but nothing better than University of Chicago for business school and just a general academic institution. So brilliant, brilliant, brilliant people. So fantastic, sort of the home of Milton Friedman and so many other brilliant, brilliant people from the economics and business perspective. So fantastic. Tell us about Crosswalk and what you all do at Crosswalk.
Yeah. So Crosswalk helps EMS agencies get compensated for the value that they're delivering in their communities. So the story behind Crosswalk is like the 911 system has effectively become the default social safety net for our communities, but it isn't paid for that. So in the process of incubating Crosswalk, I visited maybe 10 or so EMS agencies around the country. And it's so fascinating to be in an ambulance with a paramedic or an EMT. I highly recommend it to anyone that's building solutions for vulnerable communities. But you're in the ambulance, most of your time is spent waiting for the next call. And when the next call comes in, it's often not a medical emergency. So some of the calls that I had the privilege of being of riding along for included, a woman that had stomach pain for 7 days. She couldn't get a primary care appointment. Her local urgent care wouldn't take her insurance, so she called 911. Someone that had fallen and couldn't get back up. And then we dug into it a bit more. It turned out they'd fallen because they couldn't pay their utility bill and they couldn't see. Um, you also have stories of people that encounter an unhoused individual on the street and they call 911. And, all that EMS today gets compensated for doing is transporting those individuals to the emergency department. But EMS agencies around the country are trying to solve this problem on their own. So they've become some mix of care navigators, getting people enrolled in Medicaid, trying to fix the utility bill problem, et cetera, et cetera. But
It's
they're not
so
getting paid for it. Yeah.
Yeah, and let me ask you a question there because I see this now more clearly. So EMS providers, if I look at emergency departments, they're just overwhelmed. Recently, I had one of the elderly people in our family in the emergency department, incredibly challenging, even with knowing everybody. And so, in terms of EMS today, are they just overwhelmed with calls because people don't have access to primary care, they don't have access to health care, so EMS just gets overwhelmed today? Is there some of that going on, or how does that look?
Yeah, that's exactly right. That's exactly right. We estimated that something like 90% of 911 calls weren't medical emergencies, did not need transportation to the emergency department. And yeah, like EMS agencies are getting overwhelmed. And what that ends up doing is, it takes longer to get to the people that do have true medical emergencies. So that's the problem that Crosswalk is solving is getting EMS agencies connected to health insurance companies, to payers, to risk-bearing provider groups, so that they can get compensated for providing interventions in the community that stop the 911 call before it happens, right? Like that. Make sure a utility bill is paid, make sure a person in the community has access to Meals on Wheels or whatever social services it is that they need. Um, and yeah, just getting compensated for creating more healthful communities.
Fantastic what you're doing, Dhrooti. Just fantastic, amazing. One more question. When somebody gets into the University of Chicago out of high school, they go there to business school, what does that academic household look like when somebody's that brilliant and that intelligent? What does that look like? Give me a sense of that.
You're flattering me. Oh my God. I don't know if I can take all these compliments. I had a great time. I mean, yeah, like undergrad was just so fun exploring a bunch of different ideas and it was really a place to flourish. And business school was fun in a very different way. So I had a great time. Much love to the city of Chicago and its great universities.
And for those that don't know, I think the Maroons, is it still called the Maroons here in Chicago?
That's right. That's right.
And so best of luck to the University of Chicago Maroons as well. Truly, what a magnificent pleasure to visit with you. Fascinating what you do in terms of incubating healthcare companies, what you're doing with Crosswalk. You've worked with a bunch of different startups, just fascinating career. Thank you for joining us in this combined episode of the Becker's Healthcare and the Becker Private Equity Podcast. Thank you very, very much.
Thank you, Scott. Thanks so much for having me.